Good morning, everyone. Afternoon, technically. Christine here, the alcohol, tobacco, and other drug health educator for Health Promotion Services.
And I'm Christopher, the men's health educator for Health Promotion Services.
So today, Christopher and I are going to be talking about why biology impacts blood alcohol content, or I guess how sort of it impacts blood alcohol content. We're doing this for Alcohol Awareness Month, which is in the month of April, so now. So this month is really meant to bring awareness to the risks of drinking, education on how to reduce that risk, and focus on sharing support structures for those that want to moderate their habits or abstain from alcohol completely.
So we're focusing on education today, so you can understand how alcohol might impact you and you can make an informed decision about your use. We're spending some time talking about biological differences because our bodies process alcohol differently. Our focus will be on male-bodied and female-bodied individuals, not because alcohol doesn't impact transgender or intersex individuals, just because the research isn't quite there at this point and it's quite scarce.
Yeah, absolutely. So before we dive into biological differences, Christopher, what actually impacts blood alcohol content?
Yeah, so a lot of things can, but the main factors here include the quantity of alcohol you drink, how quickly you're drinking, the overall time frame in which you're drinking, body weight, and biological sex.
Yes, definitely. So all those will impact BAC kind of differently. So to dive more into just the biological impacts, I'm using a tool that I've liked and used before. I'm going to pop it onto the stream. As you can see here, this is called Virtual Bar. So what this does is kind of shows you in a virtual setting as if you were maybe out and about drinking with friends, how your BAC might sort of be impacted and the elapsed time of drinking, the time, and also the beverage chosen. So I already added a buddy system. So as you can see up top, there's a biological male at 150, 5'10", age 21, so of legal age. And then down below, you'll see a biological female, again, 150, 5'10", and age 21. Wanted to keep all those factors the same, so the only thing that is different is the biological sex. So they've already had one shot of alcohol. So you can see there's already a little bit of a difference in their peak BAC. So kind of to show this a little bit further, I'm just going to have them drink a few more times to see kind of the elapsed difference. Okay, so we had one more drink. So the biological male is at 0.038 and female 0.044. So as you can see, a pretty big difference in the concentration of blood alcohol content just with sort of four. So each one is at 4 drinks within sort of an hour period. And as you can see, this person's already in red. So that means they're already above the legal driving limit and they're going to be impacted a little bit differently. So they both consume the same amount, same time frame, same liquor, but there are clear differences that we see on the screen.
And what's interesting when you look at that is you really notice that when that weight is the same, all those things are the same. The blood alcohol concentration of the female-bodied individual still rose at much a faster rate than the male-bodied individual. I mean, 3 main factors why this is. Number one of these factors is because of differences in lean mass and total body water. Male-bodied individuals on average have less body fat and more lean mass, which increases their total body water. The more water and water-soluble tissue, the more diluted the alcohol will be in their system.
So therefore, it would then be lower. So number 2 factor is also enzymatic differences. So the main enzyme that is responsible for breaking down alcohol is alcohol dehydrogenase. So this enzyme is present in both the stomach and the liver, but the stomach enzyme is the one that actually is impacted by biological differences. So for example, the female-bodied individual has about 20 to 25% less of this enzyme in their stomach. So that enzyme's role in the stomach is to break down the alcohol so there's less getting into the small intestine and then the bloodstream. So this means that if a female-bodied person has less of that enzyme than the male-bodied individual, they can both drink the same amount of alcohol, but the female will have more alcohol enter their bloodstream than a male-bodied individual.
The third main point here are hormone differences, mostly due to estrogen levels. Estrogen levels have been found to lead to slower alcohol metabolism, therefore leading to higher blood alcohol concentrations and for longer. Estrogen peaks prior to menstruation, so blood alcohol concentration will be highly impacted during this time. This is also the case for those taking hormonal birth control. And for those that are transitioning to female and undergoing hormone therapy, it is likely that this increases the intoxication effects of alcohol just in the same way. However, changes in the enzymes will not occur.
Right. So as we just went over, the top 3 factors that differ between male-bodied and female-bodied individuals are total body water, enzyme activity, and hormonal differences. So this is why a female-bodied individual will always have a higher BAC despite drinking the same amount of alcohol as a male-bodied individual.
That's a great point, Christine. And also, if you're curious about changing your use or just like support and getting connected to resources, you can email us at Health Promotion Services at hps@health.ucsd.edu. Thanks for watching, and we'll see you next time.